Hi, I'm Amy Reimer, and I'm going to be discussing the video that we just watched about patient safety. And immediately after viewing this, I realized that the first 15 seconds you could definitely see a couple violations of patient safety. So some patient safety goals that were definitely violated was staff communication. The ball was dropped on numerous occasions where someone didn't relay the message of vitals or calling an on-call staff member when it was definitely deemed necessary because they didn't want to inconvenience them or wanted to just skim by on their job. Definitely making cutting corners, taking shortcuts, and not following through on their instincts of the fact that something definitely was wrong with this patient and they should have followed through. So that was staff communication that was definitely violated, and preventing infection was right off the bat. The nurse that watched the family member come out of the patient's room with MRSA with gloves still on, she should have taken the opportunity right at that moment to stop what she was doing and educate the family member on the prevention of spreading infection, how infection spreads, the importance of washing her hands with soap and water and removing her gloves before exiting the room was pertinent at that time. Also stopping what she was doing so she could make sure that she cleaned off the nurse's station that had been contaminated with MRSA, and if that would have been done, she could have prevented the spread of infection to other patients and staff members as well. So like I said, so educating family members, don't take shortcuts, following your instincts, following through, developing a proper care plan for each patient. Another shortcut that was taken was not when the nurse entered into the patient's room to change the IV, she did not wash her hands with soap and water or disinfect before even putting her gloves on, and then also taking them off out of convenience for herself while taking the Tegaderm off near her IV site, which could have been what was the cause of the spread of infection. So washing your hands with soap and water before and after, scrubbing in, scrubbing out before each patient, always assuming that everything that you touch does have something on it that is contaminated and dangerous for someone else or yourself. Calling the doctor even if you feel like you're inconveniencing them or they've made it seem like you may be inconveniencing them. That is your job. You are the advocate and you need to follow through. Don't just hear about prevention of infection and take it in and put it in one ear and put it out the other. Follow through, act on it. It may seem like something so minute to all the other tasks that you have to complete in the day, but the spread of infection is just going to make your job even harder and kills patients and can kill yourself or bringing infections home to your family. So cleaning, disinfecting, and burnout is not an excuse for negligence of a patient or being short with someone, or feeling like you have so many things to do and charting is on the top of your list because you need to get out on time. Stop what you're doing and make sure that patient safety is number one on your agenda, and that that's always at the forefront. Everything that started from the start of the video to the very end is things that could have definitely been prevented, and she should have been able to go home healthy, but instead the outcome was that she passed away because of negligence of several staff members not following through with the simple things that we learned on day one of nursing, hand washing and the spread of infection. So I encourage all of us as healthcare professionals to never feel like we've got too much to do and need to feel like we need to take shortcuts, because those shortcuts cost lives. Thank you.